Today we're going to be on Chapter 7. We're going to discuss anatomy and physiology of pregnancy. Now we're going to discuss terms used to describe pregnancy and the pregnant woman. We'll discuss gravity and parity. Gravida is a woman who's pregnant. Gravity is the term used to describe pregnancy. Multigravida, a woman who has had 2 or more pregnancies. Multipara, a woman who has completed 2 or more pregnancies to 20 weeks gestation or more. Nulligravida, a woman who has never been pregnant and is not currently pregnant. Nullipara is a woman who has not completed a pregnancy with a fetus or fetuses beyond 20 weeks of gestation. Parity is the number of pregnancies in which the fetus or fetuses have reached 20 weeks of gestation, not the number of fetuses born. More terminology. Post-date or post-term describes a pregnancy that has gone beyond 42 weeks of gestation. Preterm is a pregnancy that has reached 20 weeks of gestation but ends before completion of 37 weeks of gestation. Prima gravida is a woman who is pregnant for the first time. Primipara, a woman who has completed 1 pregnancy with a fetus or fetuses who have reached 20 weeks of gestation. Term is a pregnancy from the beginning of week 38 of gestation to the end of week 42 gestation. And viability is the capacity to live outside of the uterus. There are no clear limits of gestational age or weight. Infants 22 to 25 weeks of gestation are at the baseline of viability. You can find this information in your textbook, page 168. Now we'll discuss the classification system for gravity and parity. The 2-digit system, gravity and parity. First digit indicates the number of pregnancies the woman has had, including the present one. Parity would be number of pregnancies that have reached 20 weeks of gestation. Example, abbreviation, gravida 1, para 0, 1/0. This means the woman is pregnant for the first time, prima gravida, and has not carried a pregnancy past 20 weeks, nullipara. See your textbook, page 169. Classification system continued. The 5-digit classification system is commonly used in maternity centers. It is a 5-digit separated by hyphens. The system provides more information about the woman's obstetrical history. It lacks information about parity, however. Example, first digit is gravity, second, total term birth, third, number of preterm births, fourth, number of abortions, elective or miscarriage, and 5, children currently living. Example, acronym GTPAL, gravity, term, preterm, abortions, and living. GTPAL, example, a woman is pregnant only once and gives birth at 35 weeks and the infant survives. The abbreviation would be G = 1, T = 0, P = 1, A = 0, L = 1. Refer to the previous slide for more information. Another example, GTPAL. A woman is pregnant 2 times, has 1 live birth at 36 weeks and 1 abortion. No other living children. What would the answer be? G 1, T 0, P 1, A 1, L 1. Remember to refer to the original slide to see if you can figure this out. I've given you the answer. Please make sure you're familiar with this classification system. Signs of pregnancy. A woman will go through many physiological changes with pregnancy. These changes are categorized in 3 common ways: presumptive, probable, and positive. Presumptive, changes felt by the woman. They could be amenorrhea, fatigue, or breast changes. Probable are changes observed by an examiner. Hagar sign, ballottement, positive pregnancy test. Positive are those signs attributed only by the presence of the fetus. Fetal heart tones, presence of a fetus. Please see your textbook, page 170 and 171. Please be aware of presumptive, probable, and positive signs of pregnancy. Signs of pregnancy. Presumptive signs of pregnancy could be breast changes, amenorrhea, nausea and vomiting, urinary frequency, fatigue, quickening, which is the feeling of movements. Probable signs of pregnancy could be Goodell sign, softening of vaginal portion of the cervix, Chadwick sign, which is a bluish discoloration of the cervix, Hagar sign, which is softening of the lower uterine segment of the cervix, a positive pregnancy test, a positive urine test, Braxton Hicks, ballottement, which is a fetal displacement after a digital exam. These are all signs of pregnancy found on page 171 in your textbook. Please be aware of these signs of pregnancy. Positive signs of pregnancy. Visualization of the fetus via ultrasound at 5 to 6 weeks. Fetal heart tones by ultrasound at 6 weeks. Visualization of the fetus by radiographic study at 16 weeks. Fetal heart tones by Doppler at 8 to 17 weeks. Fetal heart tones by fetal stethoscope 17 to 19 weeks. Fetal movement palpated at 19 to 22 weeks. Late pregnancy fetal movements visible. No other cause for the pregnancy known. These are positive signs of pregnancy. Quickening. This is just another definition found, and I added to the PowerPoint of quickening. The first movement of the fetus felt by the mother, usually occurring during the 4th or 5th month of pregnancy, known as quickening. By the 7th month, the fetus is quite active. During the last month, the fetus becomes less active, usually due to less space inside the uterus to move around. This is just another little study chart I added to the PowerPoint. It shows presumptive and probable signs of pregnancy. You can go through and look at this. As you notice throughout the PowerPoint, I mentioned presumptive and probable signs of pregnancy multiple times. This is probably for a reason. Some nursing patient education that we would provide. The patient will have increased urination in the first trimester, and this is due to softening and compressing on the lower uterine segment. The woman will have continued need to urinate and feeling of a full bladder as the uterus continues to grow, and even if the bladder is almost empty, she will feel the need to urinate. During the second trimester, due to increased vascularity of the vaginal and cervical area and the fetal position, the woman may experience higher levels of sexual arousal. This information is found in your text on page 172. These are some presumptive signs of pregnancy I've added. Missed menstrual period after sexual intercourse, the previous month, morning sickness, increase in size and tenderness of the breast, and the darkening of the areola tissue around the nipples. These are all presumptive signs of pregnancy. Remember what presumptive means. Comparison of nullipara and multipara. Nullipara abdominal changes may not be as apparent with good muscle tone and posture as compared to that of a multipara woman. Many women do, however, begin to show pregnancy as early as the 14th week of pregnancy as they begin to have abdominal enlargement. The labia majora of a nullipara is approximate and come together as depicted in Figure 7.2 of your textbook. Figure 7.2 in your textbook is located on page 171. The labia majora of a multiparous woman may gape open in comparison to that of a nullipara. Please look at this Figure 7.2, page 171 of your textbook. Several changes that happen with pregnancy. The cervix of a nulliparous woman are rounded. Lacerations of the cervix almost always occur during the birth process. A multiparous woman would have a more oval cervix and possible scarring from previous lacerations due to previous pregnancies and deliveries. The nulliparous woman is likely to experience Goodell, Chadwick, or Hagar sign of pregnancy between 6 and 8 weeks. These are not often easily observed in a multiparous woman. See page 171 of your textbook. For physiologic changes of the cervix, please see page 173 of your textbook. Other changes that occur during pregnancy, you have Braxton Hicks contractions. They're often painless. Breast changes, enlarged, heightened sensitivity. Nipples and the areola are more pigmented. These changes are due to increased estrogen and progesterone. Cardiovascular system. It adapts to meet the increased metabolic demands of the woman's body. Slight cardiac hypertrophy, increase in blood volume, cardiac output, and stroke volume are increased. There are audible S1, S2, and S3 changes. Pulse rate increases at 20 weeks gestation. Remember, cardiac output is your heart rate times your stroke volume. This is not imperative for you to know, but it's just a tidbit of information, that pearls of information for you to know. Blood pressure should be monitored closely and accurately on a pregnant woman. If the pregnant woman has a previous heart condition, you should be aware that she may have increased issues with her pregnancy. Iron deficiency. Pica. Often women will crave things such as dirt, ice, or laundry soap. This can be a sign of iron deficiency. Not always the problem, but it can be, so be aware of pica. When dealing with a pregnant woman, assessment is key. Often things present differently with a pregnant woman. For instance, appendix will be displaced laterally and to the right, making appendicitis very difficult to diagnose. So remember, assessment is key with a pregnancy. Remember, amenorrhea, it's a presumptive sign of pregnancy, not a positive sign of pregnancy. Positive signs of pregnancy: fetal heart tones, palpation, and fetal movements, all assessed by a practitioner. Thank you, and this concludes Chapter 7.